Hello everyone, Will Dupree here in the KXAN Live studio. We have some unfortunate news to share with everyone at home. We learned just about 30 minutes ago that the first Travis County resident has now died from the COVID-19. This news came from Austin Public Health, again, just about 30 minutes ago, and we are learning a little bit about whom that person was. This is the details that we're able to share at this time, shared by Austin Public Health. What we know is that the person who died was a woman in her 70s. She had significant underlying health conditions. That, again, is being reported by Austin Public Health. And due to the family's request for privacy, Austin Public Health is not releasing any additional information about this woman. If you're just joining us, I'm Will Dupree here in the KXAN Live studio. We've now learned that the first Travis County resident has now died, and that's related to COVID-19. We learned this information just about a short time ago from Austin Public Health. This news comes as cases keep going up, positive cases keep going up. These are the latest numbers that we have from different sources at this time. There are more than 130 cases of COVID-19 in Travis County. There are now 34 in Williamson County and 13 in Hayes County. Again, these are just in our particular region, but those numbers have been trending upward for the last few days. And if you take a look now here in the state of Texas, there are now more than 1,700 positive cases. 25 people are now reported dead, and there have been more than 23,000 people tested for COVID-19, according to the Department of State Health Services. Circling back to our announcement that we're sharing at this time about this death here in Travis County, Austin Public Health has released this information as well as a statement from its director. If you take a look here, this is from Stephanie Hayden, the Austin Public Health Director. She wrote, quote, "We send our most sincere condolences to the patient's family and friends. Everyone must continue to do their part to protect our community and our loved ones." Austin Public Health is also reporting that this information from the CDC, again, this is from the Centers for Disease Control and Prevention, are that the death rates in the United States are highest among older populations, with 80% of U.S. deaths happening in people over the age of 65. According to the CDC, that's nationwide. People who are older are more at risk of dying from COVID-19. However, Austin Public Health is reporting that most positive cases in our area are happening in people under the age of 40, which means the spread among our healthiest populations will be deadliest for our at-risk populations. So you may be a young person and get diagnosed with COVID-19, and it may not be as severe to you because of your age and health. However, your positive exposure to it can then in turn harm other people around you, particularly those people who are dealing with sickness or more advanced in age. That puts them at risk by being around them and being out and about. So once again, these recommendations about being vigilant, about social distance, staying home if at all possible, this is why it's so important, because now we have had one person who lives here in Austin, Travis County die, and that death is related to COVID-19 exposure. I'm going to put up those details one more time about whom this victim was, or at least the little bit of information that we have about her. Once again, Austin Public Health is reporting that a woman in her 70s has now died from COVID-19. She had significant underlying health conditions, which again put her more at risk for a severe circumstance from COVID-19, a severe consequence, I should say, from COVID-19. And then lastly, there is no other additional information to share at this time because her family is asking for privacy. So this is all the information that Austin Public Health felt comfortable with sharing at this time.